professor of your caliber, with a rich career, something must have triggered you to stand back and question the material that you were teaching, or the truthfulness of the material you were teaching your students. Because it's easy as a retired teacher myself, I know we tend to teach the same material over and over again, year after year. We don't have the time to stand back and look at the value or even the truthfulness of the material in your case. What was that moment of revelation for you, if you like?
Yeah, that's a great question. Well, everything was going well for me. I was doing the teaching, I was doing the clinical practice, and I was doing original research. As you mentioned, as you referenced, I've participated in writing original research papers and peer-reviewed grants and that sort of thing. But for me personally, the point changed when I began developing some chronic diseases. So I got hypertension, high blood pressure, and was prescribed a medicine for that, which is standard practice. I developed abnormal blood lipids, dyslipidemia, which I was prescribed another drug for that. And I developed gout, which is an arthritis, an acute arthritis of the joints. And I was prescribed a medicine for that. And my blood sugar was slightly elevated in what was called the pre-diabetic range, but I was on the course to developing diabetes. Now, knowing what I knew at the time, I thought, well, my father had many of these diseases, and he actually died of a heart attack and stroke, but he was much, much older than I was. And at the time I began getting these diagnoses, I still had two daughters that weren't even teenagers yet. And I'm thinking, wow, this is hitting home. You know, I want to be around for them. I want to be a parent. And about that same time, I just happened to have a friend who was a science writer who was interested in writing about bad science. And he had it was well known for work he'd done about writing about problems with physics research and Nobel laureates in physics, but he had just switched to the area of nutrition and was starting to write about that. His name's Gary Taubes, and he's written some landmark books on the subject. And he was one of the first authors I started reading, and his work and many other people that have followed him and in the same line raised some questions about what I had been teaching and what I had been taught, and my overall global view of the way disease worked. And I began to investigate it and gradually came to some conclusions that were different than I'd had for the last few decades of work there.